Good afternoon, everyone. Thank you so much for joining us today. So this webinar, we're going to be talking about state budgets, how to find, access, read, understand them, and how they can be used for advocacy work. So let's go ahead and just start out with a little bit of housekeeping. So this webinar is being recorded. The recordings will be made available on partner websites. So that would include NPHA as well as Nevada Public Health, or I'm sorry, Nevada Behavioral Health Association of Nevada. That's what I was looking for. However, I have also created a YouTube channel where these are directly linked. If you go into the chat, it's up at the top of the chat. If you can't see it for some reason, please let me know. But the recordings are available there. I've been able to get them up now within a couple of days. Also, you will be able to find any meeting materials on nvbh.org. Please keep your microphone on mute. You should have been automatically muted, but when we get to the question and answer time, if for some reason you don't go back on mute or something, I do reserve the right to put you back on mute. If you haven't done so already, please put your name, title, and agency in the chat. We are trying to keep track of who's here. I've had a couple folks reach out to me for letters of participation for either their organization or their licensing board. So we'd like to just keep track of who's here and see who actually attends these sorts of things. We're going to go ahead and hold time for questions until the end of the presentation. However, as we go, if you have a question, feel free to write it into the Q&A. And then when we get to the end of the presentation and we have times for questions, go ahead and use the raise hand function in your toolbar area. And that's how we will be able to call on folks. This and the other webinars in this series are a result of a collaborative project brought to you by all 5 of the regional behavioral health policy boards, the Nevada Public Health Association's Advocacy and Policy Committee led by Dr. John Packham, and the Behavioral Health Association of Nevada. The purpose of this webinar is to help participants prepare for the upcoming legislative session, which starts on Monday. So we're just hoping to make sure that you have access to information that will help you be completely informed as to what the current status is of Nevada's behavioral health systems. We've done our best efforts to include speakers who are true subject matter experts in these specific areas, but who also don't stand to gain politically or financially by participation. We have a ton of webinars scheduled for the next 2 weeks, and then I think we're going to transition to a different series or format. This next Monday, we're having a panel of the representatives from each of the behavioral health policy boards and the RBHCs. We're going to talk about board bills and policy priorities. On Thursday of next week, we will have Dr. Sarah Hunt and believe Dr. Ashley Pruitt from Be Here NV talk about their work, as well as Dr. Tara Rains talking about the behavioral health workforce projects that Children's Advocacy Alliance has underway. Monday at noon is Youth Behavioral Health in Nevada, State Level Suicide Prevention. That is an overview given by Miss Emma White. She is also a nationally recognized speaker, author, and advocate for youth suicide prevention, as well as being the Youth Suicide Prevention Coordinator at the Nevada Office of Suicide Prevention. That following Wednesday, we have an update on Nevada's crisis response system and what's being done at the state level to build that out and what their timelines are looking like. That should be a good one. On the following day, on Thursday, we have an overview of the Surge annual report given by Dr. Terry Kearns, the Nevada Attorney General's office. And last but not least, we will have Ann Jensen from Medicaid coming in to do an overview of the Nevada and Department of Justice agreement for children's behavioral health system transformation. You've probably heard about it in the news, so here's an opportunity to learn more about someone who is overseeing from someone who is overseeing the project. A little bit about the behavioral health policy boards. There are currently 5 regions. Each board is made up of between 7 to 13 members representing different aspects of the behavioral health system. The purpose of these boards is really to advise state level agencies and commissions about what's going on in behavioral health in the region that they serve. And each board is allowed 1 BDR per legislative session. It's important to acknowledge that membership of this board is completely volunteer and nobody's being financially compensated for membership in the boards. The regions are as follows. The region I serve is that blue region up there. The northern region is those yellow western rural counties. Southern is actually the central and south rural and frontier counties. Washoe is just Washoe County, and then Clark includes not only Clark County, but the southern tip of Nye to include Pahrump. Each board has a coordinator. We're the unofficial staff of the policy boards, and we try to align our work with the priorities of the board, the deliverables associated with the funding that we're given, as well as what the priorities of the communities that we are. So we kind of stitch everything together. We work to advocate for the communities we serve, and we also act as a liaison between local and state agencies, making sure that everyone's connected appropriately. Here are your four current behavioral health coordinators. I'm there in blue. Dorothy works for Washoe. Sherilyn Rar Woods, who I believe is on the call, is in yellow. And then Mark Funkhauser, who may or may not be on the call, I didn't see yet, is there in green. The Clark RBHC position is currently vacant. And so with that, I'm going to go ahead and stop sharing and allow Elyse to go ahead and get her presentation rolling. Thank you so much, Elyse.
Excellent. Thanks, Val, for the overview. I'm really excited to be here today. Can you see my slides?
Yes.
Excellent. Hi, everybody. I am Elyse Monroy-Marsala with Cartwright NV Government Affairs. We were formerly Bells and Case Government Affairs. Same great team, same great clients, new name. On Monday, I did an Advocacy 101 training and provided the Nevada Public Health Association NPHA toolkit. Cartwright NV has the great honor to represent NPHA and their government affairs initiatives. And we've been working this interim to try and increase the amount of subject matter experts that are engaged in the legislative process. And I thought it would be a really great kind of enhancement to that advocacy training to talk about how you can use budgets to improve your advocacy efforts. Because in order to affect the kind of change that is needed in our behavioral health and our public health system, we have to advocate for better policies and better investments into our system. Okay, so my objective today is really to demystify the state budget. I want to make it feel more accessible to you with the goal, again, of increasing the number of advocates that engage in budgetary and state investment advocacy. So we're going to talk about the budget. I'm going to talk about major components of the budget. We'll do a really quick dip our toes into Medicaid, and then we're actually going to read a budget, which I've put a link to the full state budget. We're not going to look at all of it, but I've put a link to the full state budget in the chat. So when we get there, I will tell you when to open that up. All right, my first disclosure is that I am not a budget expert. So temper your expectations a little bit if you have high ones. Our state has many budget experts, and they work in the Legislative Council Bureau's fiscal division, the governor's finance office, the GFO or the budget division, and within state agencies. So if you have technical questions about the budget, about revenue, about taxes, I'm not your gal today, but I do encourage you to reach out to people in these divisions. So I am a cat expert and a bird watching expert. And importantly for today, I am an advocacy expert. And I'm here today to help you guys also learn how you can incorporate information about the state budgets into your advocacy expert or efforts so you too can become an advocacy expert. Okay, so let's go ahead and get started. Okay, so why is following budgets important? Like, why should you care about it? So not only do budgets tell us where our state's priorities lie, but budgets are where policy and program change is implemented. So policy change is important, but many times all roads are going to lead back to the budget. The budget is the state's action plan, and it balances like priorities with needs and wants. So what's a need versus what's a budget want? So a budget need would be anything that is statutorily or required by statute for the state to provide. A want would be like services that the legislature makes a policy decision about providing. I also really like this quote from former President Biden. Don't tell me what you value, show me your budget, and I'll tell you what you value. So I think that the kind of issue of universal school meals is a really good example of how budget investment is needed to implement population level policy change. So For universal school meals, the state can make a policy decision that they are going to provide school lunch to kids regardless of their family's income. They're going to provide food to everybody. But if that's the state's policy decision, you have to have funding to support the implementation of that policy decision. So I think this is a really good example of where budget decisions look like policy decisions. Again, budget advocacy is really, really important in the behavioral health and public health space because in order to make the changes to the system at scale needed to implement and impact population health, we have to invest in our systems. Okay, so what is the role of the legislature in impacting our state's executive branch budget? So, per the Constitution, the legislature is required to approve a balanced budget for the upcoming year, or what we call a biennium. So, the legislative process starts when the governor releases his budget, that usually happens to coincide with the State of the State address in early January. The State of the State was held January 15th, and the budget was released at that time. So over the last 2 weeks, a legislative subcommittee has been reviewing the budget so far. So once session starts, which Val noted is on Monday, the legislature is going to review and make changes to the governor's recommended budget. The budget must be passed by the end of session. This is actually, if you're looking at the Constitution, which I'm the kind of nerd that does that, but if you read the Constitution and you can see what the legislature's charge is, their only charge is to pass a balanced budget. While the legislature is working on the budget, they are also introducing and considering legislation and policy that is going to be changed. Well, because of the balanced budget requirement, the legislature has to essentially account for the cost to implement any of these policy changes that are being considered. And that process has happened through that process is done through a fiscal note process, and we'll talk about that. But this is why I'm excited for the opportunity to do this, because as somebody who has just been in a position to watch advocacy at the legislature in a very granular way, you see a lot more coordinated, organized efforts around policy advocacy, and then not as much around budget advocacy. And again, I think it's because the budget feels inaccessible. And I also think it's because there's a sense that I'm not going to be able, how am I one person or one coalition going to be able to change the budget? The revenue is what it is, and the expenditures are what they are. But really, all roads lead back to the budget, even in our Constitution. So it's really important to engage. Okay, so let's take a look at the budget and kind of understand from a high level the budget. So Nevada's Nevada, again, budgets on a 2-year cycle or a biennium. The state's fiscal year starts from July 1st to June 30th. So even though it's only January right now, we're midway through the second year of our biennium or our fiscal calendar. Again, the Constitution requires that the budget that the legislature sets for the next 2 years be balanced. That means our expenditures, what we spend, cannot be more than, our balanced budget means what we're planning to expend cannot be more than what we project we will bring in revenue. So you might be wondering, well, if we're looking forward, how does the legislature know how much money they're going to have if we don't have it yet? Well, that is where the Economic Forum comes in. And this is an independent commission of folks that projects how much revenue we as a state are going to have. And those projections set what we can plan to expend. Okay, so this is a very rough timeline for when and how the budget is developed. So in the spring of the year right before the legislative session, so the even year of the biennium, the governor gives direction to his state agencies to begin preparing a budget. The instructions are complicated. You don't need to know that. What you need to know is that process happens in the spring, midway through the biennium. State agencies build their budget over the summer, and it's submitted to the governor's finance office in September. Once it goes to the governor's finance office, a copy is sent to LCB fiscal, so the legislature has a copy. And then the governor's office gets to work on reviewing the budget, making sure the budget aligns with his priorities, and they wait for final projections from the economic forum to come in to tell them how much money they're going to have to budget towards. So that happens in December. So then once we have that economic forum number, we know what it's called our ending fund balance. We know what our ending fund balance is going to be, and we can start and finalizing the budget. And that's how we get to the governor's recommended budget, which comes out in January. Okay, so what do you need to know about what goes into the budget? Well, I think it's important to note that the state has multiple different kinds of revenue that populate our budget, or resources that come into our budget. What you should know is we have general fund, it's our state general fund, and that is essentially your tax dollars at work. So those are taxes, fees, assessments. That's our state general fund, but that is our state coffers. That's our state money. Then we have federal funds that come in various ways, but Nevada is very reliant, as you can see here, on federal funds. We also have highway fund, other fees, and other funding mechanisms. It's also important to know that from these revenue sources, we make two main types of expenditures. So an expenditure is either an appropriation. That is money that comes out of the general fund. So the legislature can appropriate our tax dollars. They can say, this is our state general fund. We're going to appropriate our tax dollars to this expenditure. You also have authorizations, which are made. An authorization is essentially budget authority that is granted to a state agency for them to spend federal money, essentially. Because federal money comes with the federal government, the state legislature can't appropriate it, so they can just authorize that a state agency can use it. So it's important to know when we're looking at expenditures, we have appropriations and authorizations. Okay, so let's talk at a really high level about federal funds. Again, Nevada is very reliant on federal funds. Our budget is about 30% federal funding. And federal funds come into the state many ways, generally to support health and human service types initiatives. We have federal formula grants, we have block grants, project-specific grants, and those would be like some of the grants you heard about in this series. Overdose Data to Action and SOR would be a project-specific grant. Federal funds, though, also comes in to support like social and community services, it supports education, it supports roads and infrastructure. So we are very reliant as a state on federal funding. All right, so now we're going to talk about Medicaid. So I think one of the best ways for behavioral health advocates to demystify health and human service spending and behavioral health spending is to understand at a high level Medicaid. So I'm going to do my best to break this down in a way that makes sense. So Medicaid is a program that is supported through a partnership with the state and the federal government. We use both federal funds and non-federal funds to run this program. So I'm going to explain to you how that works. So first, it's helpful to understand that the state uses federal funds through, it's called FMAP, Federal Matching Assistance Percentage, FMAP, to bring in federal dollars. So we get three types of FMAP. First, for people who are on traditional Medicaid, so this would be like moms, kids, the aged, blind, and disabled, the state or the federal government covers 62% of the cost of care for those people. For kids on Nevada Checkup, the federal government covers 72% of the cost of care for those people. And then finally, under the Affordable Care Act, Nevada expanded Medicaid beyond those who are traditionally eligible to newly eligibles. And the federal government covers 90% of the cost of care. So we have those three FMAPs that come in that help us build our budget. FMAPs change from year to year, and the way that they are set is the federal government essentially looks at the average per capita income compared to other states. So as our average per capita income goes up, our FMAP goes down. And Nevada is slated to see a drop in FMAP in the next biennium. So that means we will see a decrease in the federal funds that are coming in to support these two, traditional Medicaid and SCHIP. The 90% FMAP won't change. So we also have other types of non-federal funding, right? So the federal government picks up a percentage, we have to also then make up the difference, right? So we do that through a number of ways: state general fund appropriations, county match, intergovernmental transfers. But the one thing that I want to talk about that's really cool is the provider fees and taxes. So recently, in the last legislative session, the state essentially ratified a new provider tax on hospitals. And under this provider tax, private hospitals said, okay, Medicaid, you can charge us an assessment, you can tax us, so we can essentially opt into a matching supplemental payment program. So how these payment programs work, I had a former boss who used to call it changing the color of money. So I'm going to stretch the metaphor to try and explain it. But under the provider fee, the providers are taxed, Medicaid collects, the state collects that money, and we send blue provider taxes to Medicaid. Medicaid matches that with red Medicaid money, and then that purple money comes back to the state, and we are able to increase the total amount of money that's going to the private hospitals. So in this kind of color changing of money process, the state is able to pull out administrative fees. So when we send our purple money or our blue money, we get our red money, it becomes purple money. The state is actually able to pull out a 15% administrative fee of lavender money. And that lavender money in Nevada is going to support significant changes to our behavioral health system. The cost drivers that increase the cost for Medicaid would be caseload, the number of people on Medicaid, utilization, how frequently people are using Medicaid, and rates, what we pay for services. All right, so now we're going to start getting into a budget. This is the part that I think is so cool. So as we are looking at a budget, it's important to know that we have a bifurcated budget. So when we look at the budget, you're going to see a budget organized for performance-based budgeting purposes that aligns the budget to performance metrics, and then you're going to see a line item detail. That's the part that gets, I think, scary to look at. But some key terms that you should know that you're going to hear as you're watching budgets is a decision unit. A decision unit is essentially a sub of a line item that we are considering. You're also going to hear base budget. Base budget is the continuation of the existing level of service. There's some other things in there, adjusted base, one time, but what you need to know is the base budget is the continuation of service. There's also going to be maintenance enhancements, and maintenance enhancements are changes to the base budget that account for things like population growth and caseload growth or inflation. So we're going to provide the base budget, but in order to account for inflation, we have to have a maintenance enhancement. And then enhancements are all the new things that are going into the budget. It's important to know that the base budget is the settled budget. We're not there to talk about the base budget. We are here to talk about maintenance and enhancements. It's also good for you to know an expenditure. You're going to hear that expenditure is what we plan to spend on program, personnel, operating, things like that. A statewide cost allocation is an accounting method that you'll hear about. It's a way to recoup the cost of shared government services. And then you'll hear transfers. And transfers is moving money from one budget account in one agency to another budget account in the same agency or in another agency. Okay, these are, just know the code. So when you're looking at enhancements, they all have these different codes. Just keep this so as you're looking at the budget, you know kind of what kind of enhancement you're looking at. Okay, so let's look at a budget. So in the chat, I put the copy of the budget. So I would encourage you, if you can, open up the budget and go to page 1809. And we are going to look at the public health budget. Okay, so when you get to the budget, the first thing you're going to see is a breakdown or a high-level summary of the budget. Everyone says nobody looks at this, and that's true, but I'm showing you because you're going to see it when you look at the budget. So this just tells you high-level overview of the budget, and then we can see all the kind of funding sources that are coming in to support this budget, and we can see the activity broken down. So next, you're going to see that performance-based budgeting budgets. You're going to see a couple of these. So this budget includes activities related to substance abuse, and this is how the agency is targeting their performance of these things. Okay, now we're going to look at a program budget. So the program budgets provide a detailed walkthrough of the revenues and expenditures for each budget account. Line items are broken down into decision units, and you look at them one by one. So I'd encourage you to follow along. So if you've got the budget open, go to page 1866, and we are going to look at the behavioral health and treatment budget. So every budget that you look at in the budget, the 3,000-page budget, is essentially going to look like this. The most important thing for you to know to pull off of these budgets is this number right here. 3170 is the budget account number, and that's what you're going to use to track these budgets through Nellis. All of the budgets have program descriptions, so they tell you this is what this budget does, and also this is the statutory authority that the state has to do all of these things. Okay, so I think this is where the budget gets scary. I was a liberal arts major in college, so the first time I looked at a budget, I was like, oh, no way am I ever going to understand this. But I can break it down for you so you will know what you're looking at. Okay, so here we're going to get into the first line item part of the budget, which is the base. And we know the base continues the existing level of service from this even year or the second year of the biennium. So when we go down here, we're going to see this big long list of funding sources. So this is resources. So this is all of the ways that this budget account is funded. The very first one you're going to see says appropriation control. We know appropriations is fund from the general money or general fund. So if you see appropriation, that's general fund money. A lot of these other things are transfers, reversions, and then grants. You'll see some of the grants you guys learned about over the last month. So the SOR grant, OD2A, there's a bunch of grants here. Okay, so now let's get into this piece that I think really trips people up. So I think the best way to look at this is in three parts. So these two go together, these two columns. These two columns go together, and these two columns go together. But then these four columns go together. So this is in 2023, 2024 is actually what the agency spent. So this is what the agency spent. 24 to 25, this is the legislatively approved second year of the biennium. This is the base budget. So this is what we are continuing. Okay, so now we're going to get into these columns over here. So this is what they are proposing to continue the base budget. And you'll see there's two columns here. So we already know that the agency builds their budget, then the governor makes his budget. So this is what the agency has requested and then submitted in September of the year before. And then this is what the governor recommends. So this is for the first year of the biennium and the second year of the biennium. The budget that we are here to talk about in this session is the GovRec budget. It's good to see the difference between the agency request and the GovRec budget because it's sometimes, you can pull a question out there like, oh, if the agency recommended this, why did the governor recommend this? There's a lot of reasons that there could be a difference, but it's just a good thing to know. So again, this is the base budget. All right, so now we're going to go to the next page. And this continues the revenue for the base budget, resources coming in. And now we see expenditures. So these are all of the things that are happening in this budget that are currently being spent, because this, again, is the base budget. Okay, and now we're going to go to our first enhancement, or this is a maintenance enhancement. So this budget includes additional funding to account for statewide inflation. So inflation's crazy. It's my home budget is inflated, right? All of our budgets are inflated. It's true for the state. So they have to account for statewide inflation for all of these services. So this is what the agency has requested. This is what the governor recommends in the first year and the second year. And this is the resources, and these are the expenditures. So all the budgets are broken down this way. So once you kind of like crack the code on like resources, expenditures, and then all of this, the budgets are so easy to read. So that's a maintenance unit. So now we're into our first enhancement unit. And we also know, right, that an enhancement would be what we're considering to change in the budget. So this first enhancement unit is adding a health program specialist to this budget account. The resource they're using is this Tribal Youth Suicide Prevention Grant, and these are all of the associated expenditures. This is what the agency requested. This is what the governor recommends. We also see, since this program is adding one staff, we can see here that one staff the plan is to add them the first year of the biennium. I think it's good if you're monitoring how programs are growing to keep an eye on these positions, because sometimes a position might not happen until the second year of the biennium, right? So if you're monitoring implementation, it's good to know they're not going to staff it till the second part. Okay, so let's scroll down. So I'm not sure if this is technically the next page you're looking at, but another expenditure or an enhancement unit I wanted to direct your attention to is this one. So while many enhancements add funding to the budget, some enhancements take money away. So this is an enhancement unit that's going to eliminate grant funds for essentially the ARPA mental health block grant. So we can see that elimination here. And finally, we're going to go to the very end of the budget, and all of these line items that we just went over, the base, the maintenance, the enhancements, essentially all thread together. And this is the summary of the budget. This is very squished together on my slide, but you can see all the resources and then all of the expenditures here. But again, since we've cracked the code, we know this is GovRec for the first year of the biennium, GovRec for the second year of the biennium, and then the grand total is down here at the bottom. Okay, I'm going to fly through these last parts really fast. So advocating for budget investments. So I'm not going to get into today the ins and outs of advocating. I would encourage you to watch my last presentation that I did on Monday for that. But I do want to tell you that budget advocacy is different. So budgets are considered and debated, I guess is for lack of a better word, by the money committees. The money committees meet daily. The Assembly, Commerce, and sorry, I'm tongue-tied. Okay, the Assembly Committee on Ways and Means and the Senate Finance Committees, they have joint subcommittees. The joint subcommittees are Education, Health and Human Service, and essentially everything else. So these committees meet daily, and they will review specific budget accounts. When you're going through the budget, you can track in Nellis specific budget accounts and be alerted to when those things are agendized. It's important to know sometimes budgets are only heard once, which means there could be only one opportunity, maybe two, for you to make public comment before the legislature has made a decision on whether or not they're going to adjust the budget. It's also really important to know that if you're familiar with policy advocacy, you know what a hearing looks like. You get support, opposition, neutral, testimony. That's not how budget committees are run. The only opportunity that you have to provide testimony would be in public comment. So if you are showing up to a budget hearing and you sit through the first public comment and then you hear the budget and you're waiting for your opportunity to get called up to give your 2 minutes, you're not going to get that. If you are going to a budget hearing, plan to give your 2-minute public comment in the beginning or at the end if you can stay till the end. All right, fiscal notes. So again, we talked about the policy process that happens alongside the budget process. In order for the government or the legislature to make sure they know how much money these bills are going to impact, or the bills, or how the bills are going to impact the budget, state agencies are sent copies of these bills, and they say, tell us how much or if this is going to impact the budget. Agencies fill out what's called a fiscal note, and they provide their fiscal impact. So while the legislature is hearing all these budgets, they're also going to be the ones reconciling these fiscal notes. So in order for a bill to be passed, if it has a fiscal note on it, the cost for that bill has to be accounted into the budget somehow, or the policy has to change to mitigate the fiscal note. So once the legislative process goes through and they've closed the budgets, which happens like 2 or 3 weeks before session ends, these bills, these budgets are essentially enacted into 5 bills. So there's the education budget bill that has to be passed first. That's all of our spending related to education. Then we have the appropriations budget. And now we know, because we're budget smarties, we know that that's how the state is going to spend our general fund money. Then we have our authorizations budget bill. Again, budget smarties, we know that's how we're going to spend the federal money. There's the capital improvement budget and then the employee pay bill. Again, the legislature's only charge is to pass a balanced budget. And Nevada does not have a line item veto, which means if the governor or one of these bills don't pass, that is what triggers a special session. So these bills have to be passed in total. They cannot be amended. They cannot be line item vetoed. If the governor doesn't like this spending here, the whole budget is vetoed. That's what triggers a special session, because the legislature has to pass a budget. Okay. The legislative session is only the beginning. So if you are tracking an investment, great. If you are, and it passes, great. Literally only the beginning. If you're tracking an investment, it doesn't make it, that's okay. You have more time. I think the most important budget advocacy happens in the time between legislative sessions, and we're tracking implementation of the budget. So the state implements the budget through a couple public processes. In order for the state to enact those budget bills, they have to take a number of like administrative actions. They have to execute on leases, they have to produce RFPs, they have to hire contractors. All of that process for these things in yellow happens at the Board of Examiners. And that's a public process. You can monitor how this how the state its money that it's been appropriated to use and authorized to use through that by enacting contracts. Then there's also the Interim Finance Committee. Sometimes when we are implementing budgets, we realize we need to move money between budget accounts, or we need more money from the IFC contingency fund. And that is facilitated by the IFC. Also, if a state agency gets a grant that was not kind of authorized in the budgeting process through session, they have to adjust the budget. So if grants come in, the IFC can adjust the budget to account for the grant. Okay, so this is where you can find information about how to track these things. Another great way to track implementation is going to be attend open meeting law meetings that various state agencies have. The ECAC is a great one. The Medicaid Advisory Committee, or MCAC, I think it's called, is a great committee to monitor what is happening in Medicaid. The Board of Education is another good one. And then also engage with groups like the NPHA or the Children's Advocacy Alliance, who are pulling stakeholders together on a regular basis and talking about how the state is implementing. All right, so to close up, what does good budget advocacy look like? Good budget advocacy is evergreen. It looks like ongoing and informed engagement in the budgeting process. I think it's important to know, and I hope what you learned today is that the budgeting process starts way earlier than you think. If you show up to the State of the State or February 3rd thinking you're going to be able to move and shake in the budget, you're a little late. Engage with state agencies and through this process, these processes throughout the interim, so you can really, really affect budget change. All right, and then this is where you kind of know where to go. So the governor's finance office, they're the ones that have the Board of Examiners, and then Nellis is where we track IFC. So when you are in Nellis, you can track specific budget numbers this way. So you don't have to go into the budget to like control find and everything related to health or mental health. You can look by title and department. So that's what I have. And I would be happy to take questions at this time if there's still time. I lost track of time.
Thank you so much, Elyse. I'm getting like side comments and questions that this has been fantastic and so educational. So I really appreciate your expertise. We do have a couple of questions in the Q&A. I'm going to go ahead and take the first one, and then I'll go to someone who has their hand raised. So the first one we have from Colleen Lyons. Any comments regarding the actual shortfall in the governor's proposed budget of some 300 plus million?
Yeah, so I'm happy to tell you guys kind of what is happening with that. So when the governor introduced his budget at the State of the State, it became kind of apparent that some numbers weren't adding up and there was just some discrepancies. So at the first budget hearing that the legislature had on this, it became public that the budget that the governor submitted included what's called a structural deficit of $330 million. And that structural deficit was a result of $1.8 billion in new spending that was not offset by revenue. So because we're budget smarties now, we know that our Constitution requires us to have a balanced budget, which means revenues can't be more than expenditures. So the legislature was sent a unbalanced budget to consider. I don't know that has ever happened before. So that's what happened. So the governor his office did some quick adjustments, and they were able to close the $330 million budget deficit to $85 million at this point. So we're going into the session with, last I heard, the $85 million budget deficit, and the governor's office has been instructed to submit budget amendments to close the shortfall.
Thank you. So Maddie Larson has her hand up. I'm going to go ahead and see if I can probably unmute you. Let's see. Here we go. All right. Where are you? There you go. All right, Maddie, you should be able to talk now.
Okay, wonderful. Can you guys hear me?
Yes.
Okay, great. Thank you. Elise, this was such a wonderful presentation. I had no idea about budgets, and now I feel like at least a little bit more confident to like read them and break them down. So thank you for making us budget smarties. I was really curious. So these different grants get sent in or whatever it is for the governor to recommend budgets, and some of it changes from like what is sent in and then what the governor recommends. And I wanted to know who helps the governor like recommend amounts and like who is talking with him and being like, this is what we should recommend, and who's a part of those conversations.
That's a really good question, Maddie. So that process between agency request and GovRec, we loving governors recommended, we lovingly call GovRec budget, is not public. And the folks that are helping the governor get to that recommended budget are going to be just people around him in the governor's finance office. I also think it's really important to note that a lot can happen in state government and federal government between the months of September and December. So most significantly, we get the economic forum projections come in. So if you see that there is a significant increase in what the governor has proposed versus what an agency has asked for, it very well could be that the economic forum was just like bonkers, right? And we're flush with cash, so we can increase our expenditures. Also, the governor is going to make policy priorities, and maybe what the agency submits is not necessarily what's in alignment with the governor's policy priorities. At the end of the day, I will tell you, the agencies are going to implement the governor's recommended budget. You will not find an agency, well, maybe you could, but I can't imagine that you would find an agency that would go to the table at a budget hearing and say, well, this is what we asked for, but this is what the governor said, but give us what we asked for. The agencies are going to implement happily the governor's recommended budget.
All right, thank you. Um, all right, so it looks like do we have any other hands up? I'm not seeing other hands up. We do have some questions in the Q&A. So earlier on in the presentation, you mentioned the tax or fees for private providers. So we had a question about that from Colleen. Says, does that include both for-profit and nonprofit?
I believe the provider tax fee is just for-profit hospitals, but there might be somebody in the chat that knows better than me. But I believe it's
Okay.
just private for-profit hospitals.
Okay, good to know. The next question that we have in the Q&A is from Alicia Hines. She says, hello, I attended the first session of this series and missed the slides. Will the slides to that session be available for review? Yes, Alicia, they are available at nvbh.org in the resources section or the library section. I believe it's actually the library section. You should be able to find it there. It is always has webinar at the top of the title. The next question we have is this budget link for the new updated $85 million disparity budget?
No. So the budget that is linked is I'm just going to call it because it's what it is. It's like the problematic budget. So that's the budget that has the $35 million in errors. The governor is not going to produce a brand new budget. What he's going to do is submit amendments to the budget. I've not seen those amendments yet. There are other folks on this call who maybe have seen them, or maybe they'll be part of a public process, but that is the budget that we have, and then we will get amendments. So if you are interested in following the budget, I would encourage you to engage in the daily money committee briefings.
Thank you. All right. And then going back to the provider fees, question from Ellen is, so for the for-profit hospitals pay in 15% and then they get that 15% returned with a state match. Is that
That
correct?
is no, that's not correct. A fellow lobbyist who's much smarter than me on these things did put in the chat. I don't know if everyone can see it, but the private hospital tax is for for-profit hospitals and acute care hospitals. So it's not 15%. The hospitals are being taxed, and then the state collects that tax and they send that money to Medicaid, CMS, federal government, where it's matched, and then it comes back to us so we can implement or we can increase the payments going to hospitals. The 15% administrative fee is different. It's not they're not being taxed 15%. I don't know what they're being taxed, honestly. The 15% administrative fee is what the state is pulling out of the money matching process to invest in our healthcare system. And one thing I'd like to add, since I'm talking and you're listening, the Trump administration, one thing that he has signaled is wanting to make this money matching process a block grant process, which will significantly change how Nevada supports and funds our Medicaid system. Because again, this is the provider fee program. It's just one program that does supplemental payments where we're pulling admin fees out and then sending them to something else. So I just flag that for folks that are kind of tracking what's happening at the national level. You're going to hear discussions about changing this program to a block grant program that will completely change how we fund healthcare in Nevada.
That's really good to know. We have one more question. Jenny says, do you think the amendments to the budget will be on Nellis?
That's a good question. I would think so. I don't know. And then, sorry, there's a clarification here from my dear friend Dan Musgrove, and I really appreciate that he's helping me sound smarter because I don't want to give you guys bad information. So Dan noted that the 15% comes back from the whole amount, so basically off the top, and it's been a significant investment.
All right, thank you. Any other questions from our attendees? Feel free to use the raise hand button or pop your question into the Q&A box. All right, so I am not hearing any, and my dog is going ballistic, apparently. My apologies, everyone. So that being said, thank you so much, Elyse. If anybody has any more questions or comments, I can send them your way. If anyone would like to reach out to me, I can also, oh, we got one question now. All right, again, slides are available thank you so much, Colleen, for asking. Slides are available. I did pop the slides from this presentation into the chat, so you might want to grab those before you head out. But they are also available at nvbh.org. That is the website for all 5 regional behavioral health policy boards. And I will get those uploaded to that website immediately after we close out today. So if you don't get a chance to grab them in the chat, nvbh.org. Any other questions?
No question, but the only thing that I would plug is to engage in budget conversations during the legislative session. It's not hyperbolic to say that very few people attend these budget hearings. There is a much more coordinated effort happening in the policy discussions because I think the policy discussions are sometimes more fun and it feels like you could be impactful. Engage in the budget conversations. The Medicaid budget, I'm not sure who asked the question about the provider fee. I'm positive that in the Medicaid's budget presentation, you are going to hear more and probably get your questions answered about the provider tax fee. So please, please, please engage in the budgeting process. And also, we're all budget smarties together now. And I want to help you guys turn this budget knowledge into advocacy. My contact information is included in the PowerPoint. So please, we're budget friends now. Please feel free to reach out with me or reach out for me for questions.
Thank you again, Elyse. We really appreciate your expertise and time. And thank you to everybody who's joined us today. We hope you have a lovely weekend and hopefully we get to see you at the legislative session starting on Monday. Have a great day, everyone.